and it's preparing. All right, you guys should be good to go.
Hello, everyone. My name is Maria. I'm one of the nurses here at LCH.
Hi, everyone. My name is Marcella. I'm a nurse practitioner at LCH.
So we're just going to be going over a couple questions regarding the COVID vaccine. I'll be asking them, and Marcella, our nurse practitioner, will be answering them. So our first question is, how do the COVID vaccines work?
So the COVID vaccines have a special type of medicine in there that helps our bodies recognize the virus and then also fight the virus.
Question number 2 is, how do I know the COVID-19 vaccines are safe and effective, given how quickly the vaccines are being developed?
So the COVID vaccines first have to be verified by the FDA, and they also were verified by the CDC. And in order for them to get verified, they went through many clinical trials and had a lot of samples of people to get the COVID vaccine, where they tested the vaccine and tested for any side effects. And after testing it extensively in many people, it was found to be effective and found to have minimal side effects.
The third question is, what are the common side effects of the COVID-19 vaccines?
So the common side effects for the COVID-19 vaccine, usually pain and redness, maybe some swelling in the arm where you get the vaccine injected. Sometimes you'll have fatigue, which is just being really tired. Sometimes you can have headaches, muscle aches, chills, fever, nausea, and they usually only last for about 24 hours after the vaccine.
Okay. So just want to mention, you can leave any questions in our comments section and we will also answer them. Our fourth question is, do I need health insurance to get the vaccine?
You do not need health insurance to get the vaccine.
Can I get a COVID-19 vaccine if I'm breastfeeding or pregnant?
So if you're breastfeeding and pregnant, we would suggest that you talk to your healthcare provider first before you get the vaccination.
Okay. Can I get the vaccine if I've had COVID?
You can get the vaccine if you have COVID, but the CDC is recommending that you wait 90 days until you get your 90 days after you have COVID until you get your vaccination.
Can I get the COVID-19 vaccine if I am undocumented?
You can get the COVID-19 vaccine if you are undocumented.
If I have a chronic condition like diabetes or heart disease, can I get one of the COVID-19 vaccines?
Yes, we actually recommend, because you have these chronic illnesses, that you get the vaccine. Because if you were to get COVID, you would be more at risk to have a severe illness of COVID. So it's really, really important, if you do have any of these chronic diseases, that you get the vaccine as soon as possible.
Ninth question is, do the vaccines cause infertility?
The COVID vaccines do not cause infertility. This was not found in any of the studies any of the clinical trials or studies.
And our last question is, what can we all do to tackle misinformation around the COVID-19 vaccines?
So it's really good to look at trusted resources such as like the CDC's website or the FDA's website, and get trusted resources and share this information with your family and friends, or talk to your healthcare provider or a pharmacist.
Somebody asked a question saying, where can I get a vaccine if I'm between the ages of 12 and 17?
So the Chester County Health Department is offering the vaccine for people ages 12 through 17, and it's at Longwood Gardens.
Okay. I don't see any other questions popping up, but feel free to leave any comments or questions.
Yes, and then if you had any questions about the ages that we're offering the vaccine, at LCH, we're actually doing the Moderna vaccine. It's 2 doses, and we are offering it to anyone 18 or older.
You can always call and make an appointment, but we also have our website with the link on there to schedule via our online system. So feel free to make an appointment. You don't have to be a patient. We are taking community members as well. I believe we don't have any more questions, but you can always leave them in the comments below and we will answer you as soon as we can with any answers.
Yes. Then Maria, did you get your COVID vaccine?
I did get my COVID vaccine back in December. Did you get your COVID vaccine?
I did. I got mine in February.
Yes, so everybody should get vaccinated. Anytime you can, just make an appointment with us or you can go to your local pharmacies.
Yes.
Where did you get the COVID vaccine?
So I got the COVID vaccine at LCH. I guess it's, why did you get the COVID vaccine? Oh, so I decided to get the COVID vaccine because one, I wanted to protect myself against COVID. And more importantly, I wanted to protect my patients against COVID because I do work with so many patients that are high risk, that have many chronic illnesses. I wanted to make sure that I wasn't exposing my patients to COVID-19. And also I wanted to protect myself against COVID-19.
So
Why did
I
you
got
get
the COVID. I got the COVID vaccine to protect my patients, especially we live in a high risk area with a lot of chronic patients. I also want to protect my families and friends to make sure they don't get the virus as well as myself. So if you have any additional questions, please feel free to leave them in the chat or our team will keep monitoring our feed and answer any questions you all have. Thank you so much for joining us.